Have you ever woken up with a persistent cough, shortness of breath, or chest discomfort, thinking it's just another cold or flu? If so, you're not alone. Many seniors experience symptoms like these and dismiss them as normal signs of aging or the common cold. But what if these seemingly harmless symptoms were actually the early signs of something much more serious, like lung cancer? Lung cancer is one of the most common cancers among older adults, especially those over 60. In fact, nearly 80% of lung cancer cases are diagnosed in people age 60 and above. However, because the symptoms of lung cancer can often mimic those of common respiratory infections, it's easy to miss the warning signs early on. In this video, we're going to talk about 5 symptoms of lung cancer that you might mistake for a cold. Understanding these signs could help you catch the disease early and improve your chances of successful treatment. Before we dive into these important symptoms, be sure to subscribe to my channel and turn on notifications so you never miss critical health updates that could help you stay sharp and healthy. Let's start with the first symptom you might confuse with a simple cold. Symptom number 1. Persistent cough that won't go away. Do you have a cough that just won't seem to go away? It's natural to assume it's a lingering cold or flus, especially if you've had some congestion. But if that cough persists for weeks or even months, it could be a warning sign of lung cancer. According to the American Cancer Society, a persistent cough that doesn't improve or a cough that gets worse over time can be a key symptom of lung cancer, particularly in seniors. The cough might be dry or productive, producing mucus, and it could be accompanied by other symptoms like wheezing or hoarseness. Take Bill, for example. At 71, he noticed a dry cough that persisted for weeks. He assumed it was just a seasonal cold, but when the cough didn't go away and began affecting his daily activities, he decided to see his doctor. After a few tests, Bill was diagnosed with early-stage lung cancer. Have you experienced a persistent cough that just won't go away? Type "cough" below to share your experience. It might help someone else recognize the signs. And if you've had a cough for over 3 weeks, don't wait, talk to your doctor today. This next symptom may seem like just a minor issue, but if it persists, it could be a serious signal from your body. Let's dive into it. Symptom number 2. Shortness of breath or wheezing. Tasks like climbing stairs or walking around the block now leave you gasping for air? While it's easy to chalk it up to aging or even the weather, shortness of breath or wheezing can sometimes be a subtle sign of lung cancer, something many people overlook. Take the story of Hollywood icon Steve McQueen. Known for his legendary roles in action films, McQueen was a picture of health throughout most of his life. However, in his later years, he began experiencing shortness of breath, a persistent cough, and fatigue. At first, he thought it was just a mild illness, but when the symptoms worsened, he sought medical attention. Unfortunately, McQueen was diagnosed with advanced lung cancer, and his story serves as a powerful reminder of how easily early symptoms of cancer can be mistaken for something less serious. A study from the American Cancer Society found that up to 40% of patients with lung cancer report shortness of breath as one of the first symptoms. It can be especially deceptive in older adults, who may simply write it off as part of growing older. If you're noticing any difficulty breathing, or if simple tasks like walking or climbing stairs have become harder, make an appointment with your doctor. The earlier lung cancer is detected, the better the chances for treatment. Next, let's move on to another symptom that many people mistake for a common cold but could actually be a red flag for lung cancer. It's one that many older adults overlook without realizing its significance. Symptom number 3. Chest pain or discomfort. Have you ever experienced a sharp or dull pain in your chest, particularly when you take deep breaths or move around? It's common for many of us to chalk this up to muscle strain or even indigestion. But if it doesn't go away or seems to persist, it could be a warning sign of lung cancer. Take Tom, a 68-year-old retiree, who had been feeling chest discomfort for weeks. At first, he thought it was just his body aging, or maybe a pulled muscle from gardening. However, as the pain didn't subside and even worsened, Tom finally went to see his doctor. After a series of tests, he was diagnosed with lung cancer. Tom's case highlights how easily chest pain can be overlooked, and how important it is to listen to our bodies when something doesn't feel right. Research shows that chest pain is often linked to lung cancer, especially when tumors press against the chest wall, ribs, or surrounding structures. This type of pain can be subtle at first, but should never be ignored if it continues to bother you over time. If you found this information helpful, be sure to like and share this video with a friend or loved one, especially someone who is experiencing similar symptoms. This video could save their life in the future. Next, let's talk about unexplained weight loss, a symptom often overlooked but potentially a critical red flag for lung cancer. Symptom number 4. Unexplained weight loss. Are you noticing unexplained weight loss, even though your diet and exercise habits haven't changed? This could be a serious warning sign. Unexplained weight loss is often one of the first symptoms of lung cancer, and it's something you should never overlook. Let me tell you about Linda, a 68-year-old woman who was living a fairly active life. One day, she realized her favorite jeans were suddenly too loose. She didn't think much of it at first, figuring it was just the result of a busy few months. But when the weight kept coming off and she started feeling unusually tired, Linda decided to see her doctor. After some tests, she was diagnosed with lung cancer. It turned out that her body was burning more calories than it could keep up with, a common effect of the disease. When lung cancer develops, the body can begin to lose weight unexpectedly, because the tumor can interfere with metabolism. So, if you notice weight loss that isn't tied to diet or exercise changes, it's time to get it checked out. Finally, we're about to reveal a symptom that many people dismiss as a minor issue, but it could be the key to catching lung cancer early. You don't want to miss this last warning sign. Symptom number 5. Coughing up blood. Ever notice blood when you cough? Coughing up blood is one of the most alarming symptoms of lung cancer, but it's also one that many people brush off, thinking it's just a result of a bad cough or irritation. However, if you notice any blood when you cough even in small amounts, it's something you should never ignore. According to the American Cancer Society, coughing up blood can be an early sign of lung cancer. Research shows that about 25 to 30% of people with lung cancer experience hemoptysis, coughing up blood, as one of their initial symptoms. This symptom is often linked to the tumor irritating blood vessels in the lungs, which can lead to bleeding. Take Mark, a 65-year-old man who had a persistent cough for months. One morning, he coughed up a small amount of blood, which he initially dismissed. However, the blood continued, and he finally decided to visit his doctor. It was then that he learned he had lung cancer. Mark's story is a stark reminder that even a seemingly minor symptom, like coughing up blood, can signal a serious condition. If you experience this symptom, it's critical to seek medical attention immediately. Early detection of lung cancer can greatly improve the chances of successful treatment. Noticed any unusual changes in your body, like blood in your stool or other symptoms? Share your thoughts or experiences in the comments below. Your story might help someone else spot the signs earlier. Let's quickly review the 5 key symptoms of lung cancer that seniors should never ignore. A persistent cough that doesn't go away, shortness of breath or wheezing, chest pain or discomfort, unexplained weight loss, and coughing up blood. These signs could be your body's way of signaling something more serious, and it's crucial not to overlook them. Remember, Early detection of lung cancer can dramatically improve survival rates. According to the American Cancer Society, catching lung cancer early can increase the chances of successful treatment by over 50%. If you or someone you love is experiencing any of these symptoms, it's critical to take action now. Don't wait for them to get worse. See your doctor and get a full evaluation. If this video has been helpful, please hit the like button and subscribe for more important health insights. Share this video with friends and family. Your action could help save a life. Also, check out my other videos for additional tips on staying healthy and preventing serious health issues.